Today we're going to be discussing ethics and laws, which is chapter 5 of your textbook. Ethics refers to the knowledge of what is right conduct and what is wrong conduct. It involves choices or judgments about what should or should not be done. An ethical person does not cause harm to another person. Nurse Practice Acts, CNA training, the job description, and safe delegation serve to protect patients. Protecting them from harm also involves laws, rules, and standards of conduct. They form the ethical and legal aspects of care. Ethical behavior also involves not being prejudiced or biased. To be prejudiced or biased means making judgments or having views before knowing the facts. Judgments and views are often based on one's values and standards. They are based on culture, religion, education, and experiences. It's important to remember that the patient's situation and yours may be very different. The term code of ethics refers to rules or standards for group members of professional organizations to follow. The Nurse Code of Ethics is as follows: preserve life, ease suffering, and work to restore residents' health. Consider the residents' physical, mental, emotional, and spiritual needs. Loyalty to employer, residents, and coworkers. Provide quality care regardless of a resident's religious beliefs. Demonstrate equal courtesy and respect to everyone. Respect resident confidentiality and dignity. Perform only those procedures that you have been trained to perform. Be willing to learn new skills and keep old skills current. Care for residents as you were taught. And always be clean and professional in appearance. The following are legal and ethical behaviors for nurse aides. Be honest at all times. Protect resident privacy. Keep staff information confidential. Report abuse or suspected abuse of residents. Follow the care plan and your assignments. Report mistakes you make immediately. Do not perform tasks outside your scope of practice. Report all resident observations and incidents to the licensed nurse. Document accurately and promptly. Follow rules about safety and infection prevention. Do not get personally or sexually involved with residents or their family members or friends. There are two important regulatory agencies in the state of Virginia. The first is the Nurse Aide Training and Competency Evaluation Program. This organization makes rules for training and testing as required by OBRA. Individual state programs assure that federal rules are followed in facilities receiving Medicare and Medicaid funds. The NATCEP establishes a registry to track nurse aides working in each individual state. The second regulatory agency that is important in the state of Virginia is the Virginia Board of Nursing. The Virginia Board of Nursing is a health regulatory board of the Department of Health Professions. It protects the welfare of the public. It enforces the Virginia Nurse Practice Act. It establishes and enforces regulations for nurse aide education programs, and it establishes and enforces regulations governing certified nurse aides in Virginia. A boundary limits or separates something. Professional boundaries separate helpful actions and behaviors from those that are not helpful. Professional boundaries guide actions and behaviors to keep the focus on helping the patient. If you are under-involved, the following can occur. Disinterest, which means lack of interest in the person. Avoidance, which means you avoid the person. Or neglect, which means you do not properly care for the person. If you are over-involved, the following can occur. A boundary crossing, which is a brief act or behavior of being over-involved with the person. The intent of this behavior is to meet the person's needs. Being over-involved can also lead to boundary violations, which are acts or behaviors that meet your needs, not the patient's needs. For example, telling the patient about your personal problems or keeping secrets for the patient. If you're over-involved, it can also lead to professional sexual misconduct, which is an act, behavior, or comment that is sexual in nature. To maintain professional boundaries, be alert to boundary signs, which are acts, behaviors, or thoughts that warn of a boundary crossing or a boundary violation. Here are some rules for maintaining professional boundaries. Maintain a professional relationship at all times. Talk to the nurse if you sense a boundary violation. Avoid caring for family, friends, and people you know. Do not use offensive language. Do not visit or spend time with someone who is not part of your assignment. Do not accept gifts. Do not share personal information. Some examples of boundary signs are thinking about a patient when you are not at work, spending time with a patient during your breaks, trading assignments to get a certain patient, sharing information, personal information with a patient, having secrets with a patient, and contact with a patient after he or she leaves the facility. As previously stated, ethics is about what you should or should not do. Laws tell you what you can and cannot do. A law is a rule of conduct that is made by a government body. There are two main types of laws. Criminal laws are concerned with offenses against the public and society in general. An act that violates a criminal law is a crime. Civil laws are concerned with relationships between people. Contracts and nurse practice acts are examples of civil laws. A tort is a wrong committed against a person or the person's property. An unintentional tort occurs when harm was not intended. Intentional tort is when harm was intended. So again, an unintentional tort just means that harm was not intended. An example is negligence. The negligent person did not act in a reasonable and careful manner. A person or person's property was harmed. Malpractice is another type of unintentional tort. It is negligence by a professional person. It occurs when a professional person does not follow a standard of care. A person has professional status due to his or her education. Nurses, doctors, dentists, and pharmacists are examples. Health team members are expected to give care at a certain level. A standard of care refers to the skills, care, and judgments required by a health team member under similar conditions. Examples that could lead to charges of negligence include failing to test the water temperature before giving a shower, not answering a call light promptly, not following manufacturer directions for a mechanical lift, and not telling a nurse if a patient complains of chest pain. CNAs can only be charged with negligence. They cannot be charged with malpractice. An intentional tort means that harm was intended. There are several types. First, you have defamation. which is injuring a person's name and reputation by making false statements to a third person. The two types of defamation are libel and slander. Libel means making false statements in print, in writing, including email and text messages, through pictures, drawings, websites, or social media. Slander means making false statements through the spoken word, sounds, sign language, or gestures. The next type of intentional tort is false imprisonment. That is the unlawful restraint or restriction of a person's freedom of movement. For example, preventing a person from leaving an agency. The next type of intentional tort is assault, and that is intentionally attempting or threatening to touch another person's body without the person's consent. Next, we have battery, which is touching a person's body without consent. An example would be doing a procedure on a patient without his or her consent. The next type of intentional tort is fraud, which is saying or doing something to trick, fool, or deceive a person. Finally, the last intentional tort is invasion of privacy, which is violating a person's right not to have his or her name, photo, or private affairs exposed or made public without consent. Wrongful use of electronic communications can result in job loss and loss of certification for defamation, invasion of privacy, HIPAA violations, and unprofessional conduct. Electronic communications include email, text messages, faxes, websites, video sites, and social media sites. Informed consent is the process by which a person receives and understands information about a treatment or procedure and is able to decide if he or she will receive it. The person must clearly understand the reason for the treatment or procedure, what will be done and how, who will do it, the expected outcome, other care options, and the effects of not having the procedure. Persons under 18 years of age cannot give consent, nor can persons who are mentally incompetent, so unconscious, sedated, or confused individuals. A general consent to treatment is signed when a person enters an agency. Special consents are required for memory care units. Special consents are required for surgery. Written consent means that a person signs a form agreeing to a treatment or a procedure. Verbal consent means that a person states verbally that he or she consents. Implied consent, an example of that would be the CNA asks the patient to check his or her blood pressure. The patient extends an arm. That is implied consent. It's important to note that the CNA never obtains informed written consent. Abuse is the willful infliction of injury, unreasonable confinement, intimidation, or punishment that results in physical harm, pain, or mental anguish. Some persons are mistreated or harmed on purpose. This is abuse. Intimidation means to make afraid with threats of force or violence. Abuse includes involuntary seclusion, depriving the person or the person's caregiver of goods or services needed to attain or maintain well-being is also abuse. State laws, accrediting agencies, and OBRA do not allow agencies to employ persons who were convicted of abuse, neglect, or mistreatment. Before hiring, an agency must thoroughly check the applicant's work history, references, and any criminal records. The agency also checks the nursing assistant registry for findings of abuse, neglect, or mistreatment. It is also checked for financial abuse. Vulnerable adults are persons 18 years or older who have disabilities or conditions that make them at risk to be wounded, attacked, or damaged. All patients, regardless of age or care setting, are vulnerable. Older persons are at risk for abuse. Vulnerable adults have problems caring for or protecting themselves due to mental, emotional, physical, intellectual, or developmental disability. This can happen from brain damage or changes from aging. Elder abuse. Any knowing, intentional, or negligent act by a caregiver or any other person to an older adult. The act causes harm or serious risk of harm. Types of elder abuse include physical abuse, sexual abuse, emotion or psychological abuse, neglect, financial abuse, or abandonment. An elder, as defined by the CDC, is an older adult 60 years of age or older. Physical abuse is the intentional use of force that results in acute or chronic illness, injury, pain, impaired function, distress, or death. Sexual abuse is forced or unwanted sexual interaction of any kind with an older adult or incapacitated person. Emotional or psychological abuse is any verbal, oral or written, or nonverbal behavior that causes mental pain, anguish, fear, or distress. Neglect is failure of the caregiver or responsible person to protect a vulnerable person from harm or provide food, water, clothing, shelter, health care, and other ADLs to the vulnerable person. Financial abuse is exploitation, which is to misuse a person's money, property, or assets, or misappropriation, which is the illegal, dishonest, unfair, or wrongful use of a person's money, property, or assets for one's own use. Finally, abandonment is deserting or leaving a vulnerable adult alone without someone being responsible for his or her care. So for instance, this could include leaving the agency before your shift ends without telling the nurse, or sleeping on the job. This picture shows some signs of elder abuse. Elder abuse can include living conditions that are not safe, clean, or adequate. A sign can be personal or oral hygiene that are lacking. Another sign is weight loss, signs of poor nutrition and poor fluid intake. Frequent injuries is a sign of elder abuse. Emotional problems such as panic attacks, withdrawal from others, depression, fear, anxiety, and agitation are signs of elder abuse. Sudden changes in finances, private conversations that are not allowed, and frequent emergency room visits are also signs of elder abuse. If abuse is suspected, it must be reported. CNAs are mandated reporters. In Virginia, CNAs are required by law to report abuse or suspected abuse to their supervisor and to Adult Protective Services. Child abuse and neglect. Child abuse is the intentional harm or mistreatment of a child under 18 years old. It involves any recent act or failure to act on the part of a parent or caregiver. It can result in death, serious physical or emotional harm, sexual abuse or exploitation, and it presents a likely or immediate risk for harm. Physical abuse refers to injuring a child on purpose. Neglect refers to failing to provide for a child's basic needs. Sexual abuse is using, persuading, forcing, or exposing a child to engage in sexual contact, activity, or behavior. Emotional abuse is injuring a child mentally or his or her self-worth. Substance abuse includes prenatal exposure to substances, making a controlled substance around a child, selling, distributing, or giving drugs or alcohol to a child, using a controlled substance that impairs the caregiver's ability to care for the child, and exposing a child to drug-related activities. Finally, abandonment is when the parent's identity or whereabouts are unknown. In Virginia, there is a 24/7 hotline for reporting suspected or witnessed child abuse. Intimate partner violence is physical violence, sexual violence, stalking, or psychological aggression by a current or former partner. If a CNA suspects intimate partner violence, he or she should tell the nurse. The Virginia Department of Social Services has resources that individuals can use to get through times of intimate partner violence. Finally, a will is a legal document of how a person wants property distributed after death. CNAs cannot prepare wills. You must report the request to the nurse. CNAs can ethically and legally witness a will signing, or they can refuse without fear of legal action. CNAs should not witness a will signing if they are named in the will. Doing so will prevent you from getting what was left to you.